Okay, my name is Szakal, and I'm going to be doing the head, ears, eyes, nose, and throat exam. Okay. For today's exam, this is my boyfriend Matt, and he's going to be helping me. So first, when you do this exam, you have to look at the head. You're going to inspect all areas of it for any lesions, scabs, any discoloration. At the same time, you can be palpating for any lumps or bumps that may not need to be there. Next, we're gonna look at the eyes, and we're gonna do the visual acuity. At this point, I'm gonna have him look at a vision chart where he's gonna cover one eye and then tell me which line he can read. Can you see that? Yeah. Okay, can you cover your left eye, please? And then read whatever line is smallest.
LEFODFCT.
Close. Can you cover your right eye now?
LEFODPCT.
Perfect. Okay. Okay. So I'm gonna have you cover your left eye, and I'm gonna move my finger. When you see it, let me know. Left eye, please.
No.
Cover your right eye, please.
No.
Okay. That checks for peripheral vision to make sure that it is intact. Next, I'm gonna have you follow my finger with just your eyes. Keep your head straight, okay? Does that make sense? Okay. Good. This just checks the extraocular movement and motions. At this point, I'm gonna look at his eyes. I already know that his eyes are white. If his eyes were yellow, it could be indicative of jaundice or sclera, where there's extra bilirubin in the system. I'm going to check his conjunctivi to make sure they're intact and moist. All right. At this point, I'm going to check his pupils to make sure they're equal and reactive. All right, just stare straight at me. You can have a bright light, okay? Beautiful. Pupils are 2 to 3 millimeters, equal and reactive on both right and left. At this point, we would check the retina, but I do not have an ophthalmoscope, which allows you to look at the retina. So usually at your annual eye doctor exam, you would do that. Next, I'll look at his ears first to inspect if there's any discoloration or issues with the ears with lesions or scabs. At this time, again, if I had an optoscope, it's the tool we use to look inside the ear to check the inner ear. Again, I don't have that, but we can at least look. This just checks for wax buildup as well as if there's fluid or any discoloration within the ear. The next would be the hearing acuity, which we'd use the Weber and the Rhine test. At this point, I don't have those. Again, if you were with the doctor in your annual exam, they could check your hearing test. What I will do right now is just whether or not he can actually hear me. So I'm going to have you cover your left ear for me.
Yep.
Cover your right ear, please.
Yeah.
Beautiful. Next, I'm going to check his nose, like all other things, kind of looking at the visual. And then again, if I had an optoscope, looking inside to check the turbites as well as the meatus to make sure that the inner nose is okay, checking for drainage, whether it's intact, any issues there. Have you look up. Beautiful. Next, we're just going to palpate the sinuses, checking all the points to make sure whether or not they're inflamed. Typically, if they're inflamed, they're congested or the patient might have an infection. Any tenderness when palpating? Any tenderness?
No.
Tenderness?
No.
Tenderness?
No.
Beautiful. Last is the throat and mouth. At this point, we're just gonna have him open his mouth, check whether or not what's going on in there. You would say, ah, use a tongue depressor, move the tongue left to the right, inspect the tongue. Open, please. Say ah. Take your tongue out. Say ah. Everything's moist and intact. The uvula goes up and down just like it's supposed to. There doesn't seem to be any areas of concern. Any teeth decay or anything like that, they would have to follow up with their dentist, as this can result in other issues within the heart or parts of the body. Next, we would inspect the neck, making sure there's no issues. And then we do palpation, where we're going to check all the lymph nodes to see if they're inflamed or whatnot for signs of infection. I'm just going to push. Any pain?
Nope.
Good. No pain? Beautiful. Okay, so at this point, the evaluation is over, and then I'm going to talk a little more about etiology and prevalence. Thank you, Matthew. Appreciate it. So, there's that. Okay. So the etiology and prevalence, when this comes to head, ears, eyes, nose, and throat, or HEENT examinations, yellow sclera can be indicative of jaundice, which is a hyperbilirubin or an excess of bilirubin within the body. Some examples of these could be cirrhosis or liver disease, and the treatment of this is based on that underlying cause of the excess of bilirubin. This is meaning that you need to figure out why exactly the hepatic disease is happening. So liver function tests will be done, total bilirubin will be done for blood work, etc. Again, checking in with your doctor to see what's going on. Some causes of cirrhosis can be as simple as alcohol excess, and some other things can just be caused by an increase of that bilirubin, whether it's the gallbladder, etc. Another etiology or prevalence is a reddened, or what I call angry throat, which would be when your throat is very red and it hurts to swallow. And there might be some visible white patches. At this time, it's typically strep with the white patches. You would go into the doctor, you would have a strep test, so they would just kind of swab or culture your throat. And the treatment for this is typically antibiotics and fluids, because you always want to stay hydrated when you are sick. Another part of this would be enlarged lymph nodes. At this time, that's typically usually indicative of your immune response to either an infection, whether it's bacterial or viral. And why that's happening is usually dependent on what's causing it. Again, so you'd need to follow up with your doctor. Sometimes people can find nodules or whatnot. And in a rare case, those can be malignant. When I looked it up, it's about 1.1% of lymph nodes having nodules that were malignant. For health promotion and disease prevention. So basically, most people know when they're starting to feel sick or congested, sometimes they would use over the counter if it's a simple cold, and then follow up with their doctor if it doesn't get better in a few days. Typically, we would just need to do an annual physical, following up with your doctor, making sure everything, is status quo. Annual eye doctor exams are great to check your eyes, make sure everything is working as good as it needs to be, where they check the retina with the ophthalmoscope, as well as to see if anything's going on with glaucoma, if your pupils are reacting, any jaundice, any scleral issues. Also test your vision to make sure whether or not it's changing as it changes over the years as we get older. Routine dental checks are great as well, because like I said previously, any issues with your teeth can cause potentially like endocarditis and whatnot. Your teeth and your gums can play a huge factor in your health, and if they are decaying or unhealthy, or there's abscesses or infection, a lot of times that is a huge gateway into your body to cause a greater infection. And then simple hydration, diet, exercise will help just with your whole body's overall feeling better. Again, I'm Tara, and I did the HEENT, or head, ear, eye, nose, and throat exam. Thank you.